90% of childhood cancers are curable with the right diagnosis and treatment capacity. But due to challenges, particularly scarcity of human resources in health facilities, the cure rate of childhood cancers in Kenya is 30%.
For children cancers, what matters the most is time. How fast you diagnose it. The faster you diagnose it, the higher the chances of cure.
With the 2023-2027 strategy, the Ministry of Health seeks to improve the health workforce to standards recommended by the World Health Organization. For instance, Kenya has about 100 to 150 pathologists, which translates to 3 pathologists per 1 million people. 80% of these specialists are within Nairobi.
For example, we only have about 30 radiation oncologists in the country. Again, we find many of them want to work in the urban areas, and yet majority of our patients live in the rural areas.
Various stages of testing for cancer require finances, and therefore lack of adequate funding results in testing over a long period of time, putting one at risk of advanced cancer at the point of diagnosis.
You and me, we should not wait till when we are sick. We should be able to go out there, be screened. We
are looking at improving especially the care packages so that they are more comprehensive, and especially also children are better covered in this plan.
The current consumption rate of tobacco and alcohol is 13.3% and 19% respectively. The Ministry of Health targets to reduce consumption of these cancer risk factors, among others, to 6.5% and 10% respectively by 2028.
We want to reach to the public early enough. First of all, make them aware of these risk factors and also help them to mitigate these risk factors.
Even as the primary care networks are being established, we have the diagnostic infrastructure.
Among the recommendations listed in the strategy include adjusting NHIF funding mechanisms to ensure cover is prioritized for the most clinically effective procedures and interventions, as well as national acquisition and distribution of essential chemotherapy drugs that will allow negotiation and price optimization and ensure equitable access. Ben Kirera, K24, Nairobi.